All right, Courtney, kick us off.
Great. Thank you, Carrie. Thank you everyone for hopping on today. My name is Courtney Leverton, and I am the Director of Community Engagement at Our Community, Our Kids. We are just so excited to welcome TexProtects, I guess virtually. Hopefully we'll be able to do this in person someday, but this is where we are right now. And so just excited about this partnership. Thank you all for getting on. I think that the issues that are going to be presented today are critically important to our kids, our communities. And, you know, I'm really excited about this upcoming session because I feel like everyone is thinking about our kids, and there's a lot of alignment that's happening right now in priorities. In things that a number of important groups like TexProtects in our communities want to see done for the children of Texas. And so I'm just excited to be here, to listen, to share, and hopefully to really dive in. So I will hand it over to Knox, but welcome and looking forward to today. Thank you.
Right, Courtney, thank you so very much. We are so appreciative of Our Community, Our Kids for being our partner in this endeavor. And you know, you all are the original pioneer of the ongoing effort to implement community-based care in Texas, building on the more than a century-long legacy of ACH in serving the community, which is deeply, deeply appreciated. We are very excited to bring the Texas tour to our home communities here in the Metroplex. And we are just really looking forward to the conversation today. We sort of consider this to be the second chapter of this tour, because we did this about a year ago at this time and learned a lot about the most pressing issues that you see for us to be working on during the interim. Now, as Courtney said, we're heading into a very significant legislative session, and we have some very significant opportunities to make progress on our issues. And we are looking forward to hearing from you today about what you are seeing, what you are hearing, what you think are the top priorities. So the way we're going to proceed here is we will have the TexProtects team. And I believe Courtney is also going to be jumping in with a local perspective to talk about the policy landscape as we see it. And then we will have time for breakouts. And I know either Carrie or Brittany will describe how all of that is going to work. We very much want this to be interactive. And we are very grateful to all of you for taking the time to join us today. I also want to acknowledge our sponsor today, the Texas Child Welfare Funders, a wonderful group that actually began kind of as the North Texas Child Welfare Funders and has now expanded to be more of a statewide footprint. It includes quite a number of foundations who are incredibly generous and active in supporting organizations like TexProtects and others who are in the child well-being space. And we are very appreciative of their generous sponsorship to make today's event possible. With that, I believe we will turn the program over to my colleagues for their overview of the current landscape and proceed on from there. Thank you so much.
Go ahead, Brittany.
Okay, just making sure it was my time. Well, again, thank you all so much for joining us this morning. We are so excited to be here with you. My name is Brittany Taylor Ross, and I'm the Prenatal to 3 Policy Manager here at TexProtect. And I am joined by most of our policy team this morning, Carrie Judice, who you will hear from in a little bit, who is our Child Protection Policy Manager, and Emily Williams, who you will also meet, who is our Mental Health Policy Fellow. Before we go any further, I just wanted to also let everyone know that we will be sending out the slides and the recording after our presentation today. So don't feel like you need to furiously take notes or screenshot or anything like that, we will definitely be sending out the slides so that you have all of the information that we share with you today. As Knox mentioned, we had the honor and privilege of going to about 8 different communities and hearing from folks just like you all, within the last year. And one of the themes that echoed loud and clear, and that you will unfortunately, but fortunately, maybe hear from us about 1,000,001 times today, is the theme that continued to come up over and over again is the overall lack of support for children and families that we're seeing across the state. We also heard that we can't continue to do more of the same and stick with the status quo of the kind of how we're investing in our child welfare system right now. And again, that we should be investing more in keeping families together. So we took this really great information that you all shared with us. We talked with lawmakers, we observed interim hearings at the Capitol to really figure out what was most feasible and what would have the most impact. And all of this together helped us to land on our official legislative agenda that we are really excited to walk through with you all today. And just to take one quick step back, for those of you who aren't familiar with who we are, TexProtects is the only nonprofit, nonpartisan advocacy organization in Texas that is singularly focused on the prevention of child abuse and neglect. And we are also proudly the Texas chapter of Prevent Child Abuse America. Through education, research, and advocacy, we work to promote smart strategies all along the prevention spectrum to hopefully prevent child abuse and neglect from happening at all, but also advocating for strategies that will keep families together, prevent removals, and really just work for the best interest and safety of children who might be in the state's custody through CPS. So as I mentioned, we took what you all had to say. We looked at the data and research to try to see what is it telling us. And I think what you will see here today is that the information really points us to why it is so necessary for us to focus on better supporting children and families in our state. So let's go ahead and jump in and take a look at that. As a state, how are we doing compared to the national average when it comes to caring for our children? We all know on this call that Texas loves to be #1 in things. We love to be the best, but we aren't quite there yet when it comes to serving and supporting our families with young children. So as you'll see here on the screen, according to the State of Babies report from 2022, there are some things that Texas is doing well, but there are also some areas where we are really missing the mark. So as you can see here, Texas has more children that are uninsured. We have less families that are receiving benefits, and overall just less resilience when it comes to family circumstances. So again, this shows us that families are in need of support, and we really need to be rising to the occasion as a state to create that safety net for children and families. Another way that we know that families are in need of support is by looking at the number of calls that are coming into statewide intake that might just be for a referral to another resource in the community. We know that there are really great navigation services out there for families, such as resource and referral networks like 211 and also local navigation services like Help Me Grow. But again, we still have families that are calling the abuse and neglect hotline because they just need to be connected to resources in the community and they don't know who to call. You can see how steady this trend has been over the years. So over the last decade, 4 out of 10 calls to the CPS hotline are just because a family needs a referral somewhere in the community. We know that the Department of Family and Protective Services has recently, in this past year, launched what they're calling their parent helpline, I think, to try to combat some of this and really give parents a lifeline, within their community to be connected to resources and referrals. So we'll be really interested to see how the introduction of that hotline changes this trend over the next coming months. And of course, we hope that it results in more families being connected to the resources they need in their communities. And now I'm going to pass it off to my colleague, Carrie.
Thanks, Brittany. Yeah, so we also know that more investigations are being closed out statewide without being referred to family-based safety services, or FBSS, as we all know them. And that's really that stage of service that's in place to provide families with supports and to prevent removals. So it would appear, so if you're looking at your screen, this top line is the statewide trend, and it would appear that this trend is also true in y'all's area. And just because a family isn't referred to FBSS, it doesn't necessarily mean a family wouldn't benefit from services. But if ongoing support isn't being provided through CPS, this means we must rely on communities to reach these families outside of CPS intervention. And we also know removals are down statewide. If you've been on any sort of, child well-being, child welfare, child protection phone call recently, you've heard us talk about this. Overall, we've seen a drop in removals anywhere from 40 to 50% over the last year and a half statewide. Some areas have been impacted more than others, but the overall trend really is a decrease in kids coming into care. And for the DFW area, I realized I went too far. Sorry, guys. Sorry, I just realized I wasn't on the right PowerPoint slide. Now it makes sense what I'm saying. So we know that that trend is happening here in the DFW area as well. And so similarly, what y'all heard me just talk about with FBSS, I would say that just again, because there's not that, that level of evidence to support a removal, it doesn't mean that families wouldn't actually benefit from those supports. And I do want to just kind of pause for a quick second and talk about, why these trends might be happening. So there's been a lot of speculations as to why removals is down. But the truth is, it's really hard to pinpoint just one thing because so much has changed in the last year and a half. There's been a number of internal policy changes at the department. For instance, you guys may have heard folks talk about concurrent stages, which is when investigations and FBSS can start jointly working a case as soon as it is determined that a family would benefit from services. But we know that those cases are actually being closed out pretty quickly. And then there's also been another policy change that we've heard about that was implemented quite a while ago, basically where there are more approvals required for removing a child ages 12 and up. And so, that's just on the internal side of things. We also know the legislature was really clear last session in wanting to see less kids coming into care. And that's why we saw a change in the neglect definition. We saw a repeal in non-emergency removals, that those are no longer allowed to occur. So whether we're talking internal DFPS policies or what the legislature has made clear, we know that the intent was less kids coming into care. And whether or not, that has been more harmful or more helpful, is still, kind of the verdict's out on that. We are continuing to monitor. But what we do know, in the very least, is that ongoing supports are not being provided to families through the department, whether that be through FBSS or through removal into conservatorship. So I'm actually going to go ahead and pass off to Emily on our team to talk a little bit more about what's happening when kids come into care.
Thank you, Carrie, and hello, everyone. Due to some technical difficulties, my camera will be off, but I am here to continue the conversation. So for kids who do come into the state's custody, we have seen another issue rise to the surface, which is actually a product of a capacity issue. Children without placement, or what you have heard referred to as CWAP. So when the state cannot find a placement for a child who either just came into CPS care or disrupted out of their most recent placement for any number of different reasons, they are taken to an unregulated setting that is not fully able to meet their needs, and then are supervised by CPS staff or individuals they have hired to provide around-the-clock supervision. So these are typically kids with higher complex needs. This pie chart on the right side of your screen gives you an idea of what kind of setting they were in before the state was unable to find them an appropriate placement to meet their needs. So they may have just spent time in a psychiatric hospital where they were deemed a danger to themselves or others. They maybe had just returned from being on a runaway status, but alarmingly, a good portion of these youth are youth whose parents have relinquished them to the state because they couldn't get them the mental health treatment they needed in the community. So again, another scenario where supports aren't available in the community to keep families together. So, and on top of all of this, Texas is still in the middle of a federal lawsuit that has been going on for over a decade that continues to show that the state's child protection system continues to place kids at an unreasonable risk of harm. The lawsuit has revealed things like overburdensome caseloads, leading to the agency agreeing to a goal of 14 through 17 kids per caseworker. It also revealed things like kids being placed in settings with long histories of concerning deficiencies, leading to the need for heightened monitoring of these placements and more enforcement in the regulatory process. It has also continued to shed a light on the fact that our state is in need of expanding our array of mental health services. These are just to name a few. And while the state has made progress in remedying some of these issues, we aren't where we need to be just yet. So therefore, Texas will continue to be under the scrutiny of this lawsuit until we can make sure that kids who come into custody aren't experiencing further trauma in its care. And I'll pass it back to Carrie.
All right, community-based care. This is something that I know you guys know all about. But with all of the issues that are going on in the system, as you know, and y'all have heard us talk about before, there's a lot of pressure to do something different, especially when it comes to foster care. And one way that's being pursued is to move away from that one-size-fits-all state approach to one that's led by each community. And you guys obviously are very much far along in that process and are really leading the way in these efforts for Texas. And so I'll just kind of briefly get a little bit of a refresher here, but I really think y'all are the pros on this issue. You know, again, CBC, it started back in, more formally back in 2017. And really lawmakers have kind of seen this as like that silver bullet for what's going to fix the foster care system in Texas. We've got 16 different regions or catchment areas. And what y'all are seeing on your screen is in blue. Those are the areas that have already implemented community-based care and are in various stages of that process. Green is what actually was approved last session by the legislature. Those haven't officially been implemented yet, but the state is working towards those. And just as a little bit of a teaser, we do know that from the department that they have indicated that they want to expand into 4 new areas this next legislative session. But I think a lot of what that's going to look like is yet to be determined. We know that lawmakers, honestly, I think if it were up to them, it would be implemented everywhere in the state yesterday, and maybe even in smaller chunks in some areas. But we will be definitely watching this to see, because this is definitely something that is continuing to move forward. So based on all the information that you guys had provided us with last year, all the data that you just heard us kind of present here, and honestly, all of that really just points to the same thing. We're going to continue to be that broken record that says that we really see that all of this points to the fact that we need to do much better at providing supports to families and children, throughout. And so that really is what led us to our legislative priorities. So we're about to kind of step into those in a little bit more depth. So the TexProtects policy team will talk about those, and then Courtney's going to jump in and talk about the alignment and kind of that local perspective, what you guys are doing there. And I think y'all will continue to hear, again, more of the same, but that's the beautiful thing. So Brittany, I'm going to pass this over to you.
Thank you so much, Carrie. So our first prevention legislative priority that we're going to talk about is increasing funding for the Prevention and Early Intervention Division of DFPS, also known as PEI. So of course, TexProtects will be proudly supporting their ask for an increase in funding this next legislative session. Recently, the Department of Family and Protective Services released its legislative appropriations request, which is also sometimes referred to as an LAR. I'm going to try to not use acronyms, but if I do, I'll try to define them beforehand. We all know this, state agencies love our acronyms. But this document really just asks the legislature for increased funding above the base budget for priority items and programs. So it's kind of a good way to really look at what state agencies are hoping to prioritize as we move into the legislative session. So what we saw within that legislative appropriations request is a renewed attention on the importance of prevention services such as home visiting and resource referral navigation services to support families and young children. We were very happy to see in the legislative appropriations request that there is a specific exceptional item that is a request to expand prevention and community well-being services by requesting $85.56 million over the base budget to expand home visitation services by 50%, as well as a $2.3 million ask to support marketing and a prevention campaign for the Texas Parent Helpline that I mentioned earlier. This is a substantial and really historic increase in the prevention budget for the department. And again, really points to what we think is that larger shift happening in the state around the support of these types of prevention services. So we will, of course, be actively advocating and supporting the department in these requests moving into the 88th session. And as you can see on this slide here, this is a slide that we've had, unfortunately, shared with you probably a few times over the past few years. And as you can see here, the Prevention and Early Intervention Department currently makes up just 5% of the DFPS budget in comparison to spending on child protective services. So again, this just really reiterates why we must prioritize meeting families and offering support before a crisis occurs. And to do this, we are going to have to invest in supportive services to help families get access to these resources they need in their communities at the right time.
Brittany, I hate to interrupt.
Yeah, no, please go for it.
I missed the number that you were saying earlier before the last slide. I think you said 85. Can you repeat the financial numbers that you're looking at?
Yes.
Okay.
For the budget, I would love to. So
Yes.
the exceptional item request that is within the DFPS legislative appropriations request is $85.56 million over the base budget, which is about a 50% increase for home visiting services. And there is an additional $2.3 million ask to support the parent helpline.
I'm sorry for can you repeat that?
To support the Texas Parent Helpline that PEI has recently rolled out in the last year.
Thank you.
Yeah. And yeah, please feel free to jump in if you have any questions or want me to repeat something. So our next prevention priority that I'm going to talk about is scaling and expanding universal prenatal and postpartum home visitation programs statewide. Evidence has shown us that short-term postpartum home visitation services improve maternal and child health and well-being, while also connecting families to the resources and support they need at a really vulnerable time immediately after delivery. Universal, when we say that, we mean that this program will be offered to all families, regardless of income or other eligibility criteria. And I also want to highlight that the programs that we're talking about would be voluntary. And as you can see on this next slide here, about 1 in every 10 children in the US live in Texas. And we know that this number is going to continue to increase as more and more families with young children move to the state. I'm sure that you all have seen it a lot in the Metroplex. My family lives in the Metroplex. Every time I go to visit them, their neighborhood looks entirely different. So we know that there is, a population boom happening in Texas. So, in light of that and in light of the recent jobs decision, we know that we are going to have more babies born in Texas and more families that we really need to rally behind and create that safety net of support for them. So again, we know that there are a lot of young children and families in Texas, but who really has access to these prevention services that we're talking about. On this next slide here, you can see that there are about 1.8 million families in Texas with children under the age of 6. And we know that a little over 400,000 of these families may benefit from home visiting services. when we look at a few different risk factors. However, less than 5% of families who could benefit from home visiting prevention type services are actually able to receive them. And on this next slide here, we just wanted to bring it down a little bit to a local level. In the DFW area, about almost 3,700 families were served with prevention services through the Prevention and Early Intervention Division in 2021. So what do we know about these prevention programs that are offered through PEI? I'm going to walk through just a few outcome measures here on 2 different home visitation programs that are funded through PEI. One is Family Connect, which is a universal postpartum home visitation program that focuses on really, again, that time right after delivery. So with this program, a nurse is paired up with a family immediately after delivery, so actually at the hospital, and the nurse will come to visit mom, baby, the whole family within the first 2 weeks after delivery. And with this service, it's really just a short intervention period. It can be 1 home visit, 2 home visits, maximum of 3. But really the intention with this Family Connect program is, of course, to ensure that mom and baby are healthy. They will do a mental health screening for mom, well-being, developmental check for baby, but also it's really a holistic approach with the family as well to ensure that the family has access to any resources that they might need in their community, and the nurse really acts as that touch point to make sure that the family has a warm handoff to any referrals that they might need in the community. I'm also going to touch a little bit on parents as teachers, which I'm sure that you all are very familiar with. It's a wonderful home visiting program that has been around for a really long time. And so as you can see here with Family Connect, families that have opted into this service, we have seen a 30% reduction in maternal postpartum depression or anxiety symptoms, 50% less infant emergency medical care in the first 12 months, and 44% fewer CPS investigations at 2 years of age, and 39% fewer CPS investigations at 5 years of age. Moving over to parents as teachers, we see families who opt into this program, a 22% decreased likelihood of child maltreatment substantiations, and a 50% fewer cases of suspected abuse or neglect. So all this to say, we know that these home visitation programs offer successful outcomes for families, and they work to protect children by connecting families to the resources and support they need. I'm sure you guys are like, oh my gosh, how many times is she going to say that? Spoiler alert, I'll probably say it again, and Carrie and Emily are going to say it again as well, because we just really want to make sure that we hit home with that message there. So our strategy this legislative session is to scale and expand universal perinatal home visitation programs statewide through legislation and a possible budget rider. We had a similar bill and budget rider last session that was championed by Representative Donna Howard. Her office has been so amazing in supporting us in this work, and we're excited to continue to work with her moving forward. And the bill last session, it really seemed to have some pretty strong bipartisan support, but it just didn't quite make it to the finish line. So we will be looking at this issue again this session to see how we can continue to advocate for these services. And now I'm going to turn it over to my colleague, Emily, to talk a little bit more about our next prevention priority.
Thank you, Brittany. So we spoke a lot about prevention with home visitation and other services, and now I'd like to speak on prevention just a bit more in regards to our ACEs priority. So as most of you know, our aim with this bill is to make strides in improving the delivery of prevention services and increase the availability of these services so that all families and children from all backgrounds can access them in order to prevent ACEs from happening in the first place. So here on this next slide, we have a glimpse at the prevalence of ACEs in Texas. This is from the National Survey of Children's Health. I will say, however, that this survey is based on parent self-report. and it doesn't include questions about child abuse and neglect. So even these numbers likely underestimate the actual incidence of ACEs. There's a lot here, so feel free to read this slide while I touch on just a couple. So the highest percentage comes from children that have experienced the divorce or separation of a parent, as approximately 1.8 million children have been impacted by divorce or separation, which is about 1/4 of children in Texas. The second highest was the 12.4% that reported that they had difficulty paying for food and housing from their household income, and that was reported at somewhat often. So while this data is very crucial to understanding the prevalence, I just want to remind everyone that these numbers make up like hundreds of thousands of children's real life experiences. And so that's something to keep in mind. And then we know that often adverse childhood experiences can also be very traumatic experiences. And we also know that trauma can increase the likelihood of negative outcomes across the lifespan development. Trauma poses great risk to mothers and babies, as it can increase health risks during pregnancy and cause preterm birth and low birth weight. It can also cause significant deficits in brain development, such as cognitive impairment. It has been proven to increase the likelihood of one experiencing a chronic disease, such as diabetes, cancer, and others. In the school and work settings, we often see children being expelled from school, having a higher academic failure rate, and adults losing time at work in order to seek treatment. And lastly, we know that there's an increased rate of participating in risky behavior, such as substance use, violence against others, and unsafe or risky sexual practices. So now let's look at some of the economic impacts that ACEs can have. TexProtects estimates in 2019 that Texas spent approximately $52.9 billion on the lifetime cost of confirmed child maltreatment cases. Some of the most staggering numbers come from the national health spending cost, with $168 billion for illicit drug use and $160 billion annually for smoking. So research shows that reducing trauma within families can lead to better financial outcomes later. Those who experience 4 or more ACEs across their lifespan are 1.6 times more likely to live in poverty as an adult than those who have not experienced ACEs. And in 2019, about 1.5 million children were living in poverty. And this ranks Texas at about 40 out of 50 states when it comes to the overall poverty rate. So all of the issues I've mentioned here today are reasons why we push the ACEs bill. This bill will help us connect with stakeholders and communities across Texas to better identify what is working and what is not, to really tackle the cause of childhood adversity. It will give state agencies back community guidance to better identify strategies to increase effectiveness of state prevention dollars. We can then use these findings to propose recommendations to the next legislator so that we can continue to do what works, stop what doesn't work, and make children and families strong again. So that wraps up our ACEs priority. I'll now pass it on to Carrie.
I almost forgot to unmute. Okay, so I'm going to shift us into talking about some of our other priorities, starting with kinship. So our ultimate goal that we're striving for this session is for more children to be placed with relatives by making sure that these caregivers have the supports that they need. And we actually have 2 strategies, and I'm going to walk through those with you guys. One of them is up on your screen right now, but I'll kind of explain the differences and things like that. But first, let's maybe kind of jump into some definitions, just because in this field, we tend to use a lot of words interchangeably. And sometimes we like to use words and people may not know the difference. And so we want to make sure to kind of start there. So let's do some level setting. So first of all, when we say kinship or kin, what we mean is relatives or friends of the family who step in and care for a child when it's unsafe for them to remain in the home of their parents. So again, you'll often hear kinship, kin, relatives kind of used interchangeably, but that is what we're talking about. And honestly, y'all, we know that relatives step in and care for kids in all kinds of scenarios. So that kind of leads me to this other, definition of informal versus formal. So when kin steps in and cares for a child in their home, when CPS doesn't have custody. So what we're talking about is CPS being involved. Maybe that's during an investigation, or maybe that's during family-based safety services when they're providing those family preservation services. That is what's called an informal kinship placement. But then when kinship, steps in and cares for a child in their home when the state does have custody. So, maybe the word we're using is conservatorship, but basically when a child is in care and they're placed with a relative, that is called a formal kinship placement. So again, just wanted to do some level setting because we use a lot of phrases and sometimes we can forget to kind of pause and remind you guys what those words mean. And so you heard me mention two strategies. And the one that we're focusing on for those informal kinship placements, what we've continued to hear are there are two main barriers, legal and financial. And so when the state doesn't have custody, a lot of folks don't know that actually the department doesn't provide any sort of financial assistance. So again, during an investigation or during those family-based safety services cases. And so also what we know is that, sometimes the department may dismiss a case with that child remaining in the home of that relative. And in a lot of those circumstances, that relative doesn't have any sort of legal standing. And so those are the two main things that we've heard from a lot of folks in that space. So to address this, what we actually want to see is a pilot program that would ensure relatives are provided and connected to both those legal and financial supports, because ultimately what that will do is hopefully prevent a removal, which we know can be very traumatic. So what we want to see is that a case manager is assigned to that relative, because oftentimes, case managers that are working with relatives, there are unique needs there. There's different kinds of services that they may need to get connected to. So we need somebody that really specializes in that to be able to help the families that they're serving. But then also our hope would be that this pilot program, that it's inside a court. And what I mean by that is that there would be a judge overseeing the case, because again, in those circumstances where it may not be where we may not be able to actually dismiss the case with the child going home, but we know that maybe it's just temporary. And so in those situations, the court would be able to provide some sort of legal standing for the relative, and potentially even some of those recommendations for what it will take for the child to be able to return home. So that's our informal strategy. Next, again, so we're talking about formal kinship. That's our other kinship strategy. So reminder, these are the ones where kids have been removed from their homes and the state is involved and the state has custody, but they're placed with a relative. And so in those situations, a relative can become licensed or not. And so for those who choose to not become licensed, and there's a slew of reasons that we'll kind of get into later, we want to make sure that those relatives are receiving pay parity in line with what foster parents receive for the duration of time a child is placed in their home. There are certain reasons I'm using and emphasizing a couple of those phrases, which we'll get into here in a second. So what do we know about kinship placements? First of all, we know that the department does prioritize placement with kin when that's appropriate. And we know that 43% of kids in CPS care are placed with relatives in the different regions across Texas. But when we're looking at these numbers, there's really only a small percentage of relatives who actually decide to get licensed. So the number at the end of last August 2021, showed that only about 8% became licensed. I've seen a different number when you're looking at the number of relative placements across the fiscal year, and that's more like 12 to 14%. But regardless, those are very small numbers in comparison. So we know that not many of those kinship placements are becoming licensed. And we've heard a number of reasons as to why. It could be something on their criminal history check from a long time ago. Sometimes it's family dynamics. Maybe that relative doesn't want to step in and become licensed because they're thinking this is just going to be temporary, don't want to jump through all of these hoops to be able to do that. Or maybe they see that as adversarial to the parent, right? And so there's just a lot that can be at play there. And then sometimes it may just be folks saying, not that anything's wrong with their home, but maybe they just don't want that level of regulation. So again, we've heard a number of reasons as to why folks may not want to become licensed. It could also just be the length of that process. So I do want to stop here really quick though, for any of you who kind of like to look at the history of like, well, what does it look like for us to actually provide, those financial supports to relatives? And what I love to be able to tell you guys actually is that a lot has been done by the legislature over the years. I can remember back in the day when relatives didn't get any sort of assistance. And then eventually we kind of had moved as a state to provide them with I think it was like $1,000 stipend. And then what we see now was actually put in place, something that TexProtects had advocated for back in 2017. The way the current statute is written is that relatives can receive up to 50% of what a licensed foster placement can receive for up to 12 months. And there can be like a 6-month extension under different circumstances. But that's essentially what is in place now. And if you're curious what that number is, what is that up to 50%? What you can see on your screen is right now they've got that $1,267 per day. So just wanted to make sure y'all knew that. And just something else I do want to plug when we're talking about supports. The department has actually made a recommendation for this session that they want to provide, they're asking for an additional $6 million above the baseline budget in order to provide those kinship caregivers with up to $1,000 in supports for concrete services, and also reimbursement for up to $750 if those relatives do want to become licensed through that process. So we're really glad to see that the department is prioritizing kin as well. So y'all heard me say earlier I was going to kind of focus on some different phrases, so we'll talk about that here. So we've seen the legislature really move the needle forward, and we believe that next step is pay parity. And so here's the different components that we consider as part of pay parity. So first of all, that 12-month limit, we think that's got to go. We want to ensure that relative caregivers receive compensation for the entire time a child is placed in the home. It just makes sense, y'all. If a child is going to be in the home, we want to make sure that the relatives receive the supports that they need, because ultimately that supports the child. Next, we also want to remove that 50% cap. It's limiting. And so we also, with that, the language that's in statute talks about up to 50% of the basic reimbursement rate. That has to do with the level of care system and what our current rate methodology system is here in Texas. I won't get into this in depth, but what I want y'all to know is there's currently a whole rate modernization project that is going to be changing how we reimburse placements. And so because that's underway, and obviously we're very hopeful that that goes into effect, we just want to make sure that the language that's currently in statute isn't limiting for when that goes into effect. Another thing that I do want to just also put on y'all's radar is this approved placement piece, because part of getting reimbursement, you have to have an approved, like that placement in your home has to be approved. So what we've been hearing is that sometimes if the department doesn't approve a home study, and that can be for a number of reasons, they can't technically approve that placement. But let's say, obviously there's a court overseeing the case. The judge approves the placement, so therefore the child remains in the home. What we have seen is that's not considered, I'm going to put air quotes, an approved placement, and so that relative's not able to receive the compensation. So we just want to make sure that whether it's the department approving the placement or a judge approving the placement, ultimately if the child is approved to be in the home, we want to make sure that they can receive this compensation. So those are kind of the elements of this strategy. We are thrilled that, like you heard me say, that the department's prioritizing kinship. We've heard from a number of our partners that they are also prioritizing kinship. And so we were really excited to see that there's so much alignment there. And y'all are going to hear from Courtney later about that as well. But what I do want to just say, because we get this question all of the time, is we are not trying to disincentivize licensure. We just want to make sure that if for, again, those reasons you heard me say earlier, if it just doesn't make makes sense for that family to become licensed for any of those reasons, that they're able to receive the support that they need to support the child in their home. All right, so that was kinship. I'm going to move on to data. You guys may remember we had a data bill last session, and so we're kind of wanting to pick up and run with that again. And just as a reminder of what we mean when we say our data bill and what that's about, it's about making sure that the child protection measures, those critical child protection measures, are available and updated monthly. Because historically what we have seen is that the department has updated and put that information out annually. And so, you know, we want to make sure that information is available to the public. We want that to be a transparent process. We want, you know, also for things to just be effective, right? Like lawmakers are needing to make decisions. And so they need to know what information is out there. They need to be able to see those trends in real time. We want lawmakers to be able to invest in an effective way. But also, you know, with community-based care. We've got so many different communities moving forward with that implementation. We want to make sure that those providers have the information that they need in real time as well. So just going to throw this up on my screen really quick. Again, y'all heard us say earlier, you know, Brittany had shared, and I think it's in the chat too, we will be sending these slides out. So that information, if you haven't checked out what's already on the DFPS website, you can check that out here. This is really just a screenshot. So again, y'all heard me say we had this priority last session. We weren't successful in getting the bill to pass, but we were able to see that a budget directive requiring the monthly information was adopted. We are excited to see in the department's legislative appropriation request that is still intact. So if you were curious and you're going, well, Carrie, why are y'all promoting this again if it's still in there? It is because we just want to make sure that this information continues to be in there. So putting that into statute will help, you know, that way we're not coming back each session to fight for that information to remain in there. We've heard a lot from a lot of folks that this has been really helpful. All right, last but not least, and then I'll pass over to Courtney, we've got a workforce priority. So first of all, real quick, want to make sure we're on the same page about what we mean about workforce, because workforce is a conversation in so many different areas right now. What I'm talking about is those frontline workers, okay? And so what we really are kind of wanting to tackle this session, our goal is that high quality workers are at the department all the way up the career ladder, not just in those, you know, frontline worker positions, but also being promoted into positions of leadership. And, you know, we really think that this needs to be tackled from several different areas, such as recruitment, hiring, retention, and promotion. So let's jump into what I'm talking about and what some of the data shows us. So, you know, when you're talking about recruiting and hiring and retaining workers, how do we get people interested in working for the state? And then once they get there, how do we keep them there? You know, so I think you guys know, if you've, you know, turned on your TV, if you read any news articles, there's always been this issue with turnover at the state. And so y'all are looking at some of these numbers on your screen. We know that there's like about 40%, and those numbers are still climbing, by the way, if you look at the monthly numbers. 40% of investigators leaving the state, 21% of those conservatorship caseworkers leaving for obviously, I'm sure there's a different number of reasons for that. And I know there was an article, I think, out not too long ago about like this mass exodus of investigations workers since the beginning of the year. So when you think about that, if what the community is seeing and hearing is, oh gosh, you know, so many people leaving the state. Oh gosh, they're still in this decade-long lawsuit, all of these different things. What is attracting people to work at the state? What is attracting the right people, the ones that, you know, are high quality workers to work there? So we know that pay is a piece of it. You know, back in 2017, TexProtects had really advocated for those salary increases that we saw then, which was really great. We know that the department is also this upcoming session promoting a 10% salary increase across the board for frontline workers. Those are all great, but it's really just one piece of the puzzle. We really have to consider more than just pay. And then I think also, if you've been in any conversations about child protection, it's how do we promote that better culture and ensure workers are not overburdened. So one thing I just wanted to kind of show you guys again, because y'all are hearing us kind of talking about that like promotion all the way up the career ladder. So we really wanted to kind of dig into this pay differential. And I think that's, one of the things we learned is that actually when you're looking at like the state auditor's office report really does show that market value, that workers are really getting paid, very similar to the equivalent in other fields, but it really seems to be the benefits that seem to be part of the issue. For instance, if you're an investigator and you want to promote to be a supervisor, you lose your stipend. On the CPS side, if you are a caseworker and want to become a supervisor, move up that chain, you lose the ability for that overtime pay. You lose the travel check that you once had for, for getting out and going do all those visits. So we know that like part of it is we need to address the benefits issue. And so when we start thinking about pay, benefits, what else really needs to change to have that better culture and to get folks, those high quality workers in all positions, we were kind of trying to figure out how we could go about that. And currently the department is required to do a human resource management plan, and it details. Mostly though, the charge is to detail how to retain workers. We think that needs to be expanded to include how do you recruit those high quality workers? How do you hire them? How do you retain them? And then how do you promote them? And so I think having the department go through this strategy, go through this process will be very helpful in them considering what needs to take place for that to happen. And then when they put out this report, part of that report is giving recommendations. And once we know what those recommendations are, it'll set up groups like ours to be able to advocate to the next legislature what needs to be in place. So that is all from our team, but I do want to pass over to Courtney because I think that'll kind of, obviously we were talking about alignment, but I think what you'll hear from her is a lot of more of what we're talking about at this higher level, but what's going on in y'all's area. So Courtney, you're still with us. I'm sure I'm going to pass it over to you.
I am. Thank you, Carrie. So yes, I'm really excited that I get to talk to you all for a minute because we are excited about TexProtects priorities, and what you all saw were a lot of statewide trends. And with our area being under community-based care, being served by our community, our kids, some of those things just look a little different. And so I'm really just thrilled to have the opportunity to speak with you for a moment. Okay, Carrie. So I'm just going to run through this slide really quickly. We at our community, our kids deeply believed in community-based care. We think that there are a number of strengths with it. It allows for innovation and flexibility. We're able to integrate placement and permanency. We have measurable results that we are held accountable to. But on top of that, we have really good data that helps us just dive into those. And then, we really have the combination of local authority and state oversight, which is another strength. So what I really want to talk to you all about are some of the advantages that we're seeing in our area. And these advantages really relate to some of the areas that Carrie, Emily, and Brittany covered in their wonderful presentation. So the first advantage that I really want to tackle is our reaction to challenges that we face. And the example that I really want to give is the children without placement. So Carrie, if you can go to the next slide, please. This slide that you'll see shows a graph of kind of what children without placement have looked like both statewide and in the SSCC regions. So I do need to kind of level set here. We have in the SSCC regions about 20% of the kids in the state. So when you're viewing this graph, make sure that you understand that it's not apples to apples. However, when looking at trends, you can see that there has been relatively low children without placement in the SSCC regions. We received dollars from the legislature that helped us put together a capacity building plan in 60 days after receiving those dollars. We are executing that plan in a number of areas. We have a foster care recruitment blitz. We have provider support projects. We are credentialing our supervisors. So to speak to that workforce piece, we are elevating the role of our supervisors in our organization to hopefully give them just kind of the credence that they deserve for the hard work that they do. We are definitely lending a lot of those dollars to kinship, which I will cover shortly as well. But there have been a number of strategies to tackle CWAP, those dollars being a piece of that in each of the SSCC regions. Our strategies have been different. Our regions are different. And so I think it's important to note that again, that's the beauty of community-based care. We didn't come up with a one-size-fits-all plan and try to all execute it, but we did work together to kind of share strategies and figure out how we were each going to tackle this problem. And it's resulted in good things for kids. So on to the next slide, please, Carrie. So this slide just kind of portrays the fact that we have faced challenges before, particularly with capacity. And so in the beginning of our contract in 2014, we saw a number of instances of children without placement. And then we worked really hard to build capacity. And I want to qualify here that we don't just build capacity as an organization, we build the right kind of capacity. We identify what the children who we're struggling to find placement for need. Those extra supports that are needed in the capacity, whether it's residential treatment or treatment foster care, which we here call professional home-based care, because we really do believe that those caregivers are professionals and should be treated as such. And so you can see that we had a really long period with relatively no children without placement. And then, like the rest of the state, we saw some spikes starting in October of 20. Again, we put some strategies in place. We really worked to tackle this problem. We did during this time have a house that's furnished, that when we do have these instances of children without placement, we want to make sure that our kids are in a safe, secure environment when our workers are having to care for them. But it is a place of last resort. We really believe in working with our network of providers to provide the best placements for our youth possible. And it's really thanks to their partnership that these numbers stayed relatively low during this time of challenge. So just another advantage that we really are seeing with community-based care is the ability to innovate to really improve our results. And the one area that we can really point to right now is kinship. So next slide, please. Okay, great. So we do have a contract outcome of tracking how many kids are placed with kin by day 60. And that is something that we have really been paying attention to. We wanted to just ensure that we're doing what's best for kids and getting their initial placements correct with family, if possible, is what's best for kids. And so you can see when we took on CBC responsibility, we were at 21.6% of our kids placed with kin, and now at that 60-day mark, we're looking at 30% of our kids. And so the things that we have done to increase those numbers is we piloted a number of programs. We worked with a fantastic contractor out of Pennsylvania who really showed marked results in their area and have now gone throughout the country, really consulting with other groups to help them achieve those results. We brought family finding and home study writing in-house. We knew that there was a lag in contracting those services, and so we made a commitment to creating those positions and making them OCOK employees. We had a pilot project that ran that's now completed, but we embedded with a couple of investigations units in Tarrant County to ensure that we were picking up removals as they were happening. And that has concluded, but it really created a foundation for strong relationships with our investigations and an opportunity for education on how critical it is for us to have the knowledge of kids coming into care so we can begin that family finding process. So on to the next slide, please, Carrie. So this will show you our total kinship care growth. So while our contract outcome is, really important to us, it's critical that we know that we're putting as many kids with kin as possible, even if it's not at that initial 60-day. And so this is important for a few reasons. Again, it's good for kids, but also we want to make sure that we have the infrastructure and supports for our kinship families as we look at increasing placements, and we want to make sure that there's stability as well. And so you can see that when we began our contract in March of 20, the children in our region were with kin at 19%, and we are now sitting at 31%. Again, those strategies that I talked about on the last slide are really what can be attributed to the success. We're not done yet though. We would love to see 30% of our kids placed with kin. Again, this is not just placing kids with kin though, it's supporting our kinship caregivers. It's making sure that those are successful placements. So the work does not end after that placement takes place. We have an incredibly dedicated team of kinship workers, and we have a great partnership with ACH and their Kinship Connections program, and a number of our providers who really lift our caregivers up and ensure their success. Okay, so on to the next slide, please. So just another advantage that we believe in, I think it's the foundation of community-based care, is just the power of local relationships. And just a few examples of those relationships, if you can go ahead and flip, please, Carrie. Okay, so we have we have worked with the Tarrant County community. We recognize that there was a large gap in services in our community for our children with mental health challenges. And so we gathered a group of interested stakeholders and held a few listening sessions to figure out what exactly our community needed. We took this information, we went back to Tarrant County, who we knew had some pretty significant ARPA funds that were dedicated to mental health, and we proposed a secure assessment facility. Those funds were granted, and so ACH, in partnership with just a number of local stakeholders, will be building a secure assessment facility. This will be a place for our youth to land, to stabilize, to be properly assessed. And we hope that it'll be great not only for our foster youth, but also as a community resource. It will serve both youth in care and just community youth who need somewhere to land as well. And so this is a project we're very excited about, and we think that it will, just serve youth well. So another thing that I'd love to point to you is, since 2014 and the beginning of our contract, our community, our kids, has deeply believed in lifting our providers up. We know that we could not do this work without good, solid providers providing those foster homes, residential treatment centers, GROs. And so we've genuinely wanted to work with them and help them out, when they face roadblocks and struggles. But we are formalizing a provider support project just so that we can really ensure the success of our providers and keep our good capacity. Just a couple of other things I'd love to point to: some innovative work with our child welfare boards. We are working with Parker County in particular, who are forming what's called a home base. Oh, thank you, Carrie. I was wondering where the rest of my slides went, but I was just going to dive in. I'll go back to functional family therapy in a second. They basically have rented a space. They're working with both, with all three, us, investigations, and FBSS to create a space for our workers to go gather items. So like a rainbow room. They will also have visitation space, and they're just really, really committed to ensuring that our staff has what they need. On that same front, our Palo Pinto board really realized that the rainbow room isn't just needed for investigations. It is critical to helping staff get what they need for the families, particularly in those kinship situations. And so they actually brought a rainbow room in-house within one of the OCOK offices. And just some other cool things that are happening in Hood County. They're creating a technology platform for workers to put in requests for kind of immediate things that families need. And so this has just been really great. Each one of our child welfare boards works really well with us, and we're just thankful for their commitments to our children and families. And then the other example that I really wanted to point to is we do have a Families First pilot project underway. And when we were kind of initially tasked with taking it on, we pulled together with TFI to create a site with Vision Quest to provide functional family therapy. And just having this collaboration between SSCCs to build capacity quickly to offer these services to families in need, I think is really just a cool thing that we can point to about how we work within our community to make things happen for children and families. So those were just a few things I wanted to touch on. I do want to just say one more thing before I hand it back over to Carrie, Brittany, and Emily. We are really working on our workforce as well. As a community provider, things look a little different for us, but we have employed a number of strategies to help grow and stabilize our local workforce. And so it's something that we're deeply committed to. And just, I think that, you know, ultimately having the flexibility to figure out what our workforce looks like and what their needs are has been just a really great thing. And I think that some of the strategies that we've employed are starting to happen, and we're excited to kind of see how those work in really taking care of our own workforce. So thank you for your time. I'm looking forward to the discussion and just thrilled to be here.
Well, thanks, Courtney. So we are going to enter into a time of breakout discussions. What we ask, so there's two rooms. There's going to be one for that's kind of more prevention focused, and there'll be one that's more system involved. And so we have some of those, topics on your screen here. We ask that you join the one either that you're really, really interested in hearing more about, or one that you maybe have the most expertise and knowledge to provide. Again, we're looking for any sort of context, any sort of alignment of things that y'all are working on that we need to know about and how we can partner together. But go ahead and when you get something that puts up on your screen, choose which of those breakout discussions you want to join, and there will be some TexProtects folks. So Emily and Brittany will be in the prevention one, I will be in the system involved one, and we'll be taking some notes just to make sure that we are keeping up with all the great information y'all are providing. And while we are waiting on that prompt, we will bring you guys back when there's about 10 minutes left. So just so y'all know. how did I manage to not unmute myself? Okay, are we all back? I think I saw a lot of folks come back. Sorry if anybody was mid-sentence whenever we shuffled you back here. I just was saying to the folks in my room that, you know, this doesn't have to be the last conversation. This hopefully isn't the last conversation we have with you all. And so we will be providing our contact information if y'all don't already have it, but we would love to continue these conversations. And thank y'all for hanging out with us. Let's see, I think we usually see a little bit of folks having to hop for another meeting or different things like that, but thank y'all for those of you who participated in the breakouts. I'm going to kind of speed through this conclusion. This is really about how to engage with our work, how to stay up to date with what we're doing over at TexProtects. Some of this, if you've joined us before, may look familiar, but I do want to kind of walk through this with you guys. If you guys are not already receiving email updates from us, please join that so we can keep you updated when we have events like this. Some of you have also hopped on and probably taken part in like our lunch and learns. And so we often push out to our audience different events like that. But also during session, when bills that we're talking about today are moving, we'll be letting you guys know. We'll be asking you guys to participate. So when you go to our website, TexProtects.org, I think you have to scroll kind of far down, but there's a little box that looks like this. If you can put your information in there in your email, that is how it's hopefully simple to get information from us. Here's some more specific things. You know, we've got different ways for you to kind of engage with our work, obviously, just to kind of know what we're up to and be able to join the different events that we have. That email sign up is going to be a really good thing to do. Obviously, we would love for you guys to get involved in the advocacy efforts by reaching out to your own legislators in your area and, you know, the committees where these bills are going to be going through. But one thing that I'll at least point out on this slide, you see all the way to your right, that advocacy alert. Again, if you sign up for our emails during session, when we have different strategies going on, we may push out something to our network saying, hey, please reach out to your representatives and let them know you support this effort. We try to make that easy on you. We'll often provide a little bit of verbiage that you guys can kind of use, either just that, or if you want to tweak, you can. But that's just an easy way to get engaged or share things that we're putting out on social media, things like that. But like I said, we try to make it easy on you guys as we can. We wouldn't be doing our jobs well if we don't resource you well, but these are just a few of the resources that I wanted to make sure you guys have in your back pocket. We obviously have more than this on our website and have more if you guys are like, hey, Carrie, send me this. Please feel free to follow up with us. But a lot of the slides you saw today about like the data pieces come from our State of the State report. So check that out. There's more information in there. We do this every year whenever the department updates their fiscal year information. And so we've got those 2021 numbers on this State of the State. Also our flow charts, feel free to use those. Feel free to hand those out if you've got folks reaching out to you, curious about how the system works. We also did a more recent, one of our most recent resources is the CPS 101. This is actually something we did alongside with our sponsor of this event, the Child Welfare Funders. It's just a CPS 101 of kind of like that high level. What are the goals of this system? What are some of the phrases and terminology that you'll hear? What's kind of going on in the system that's impacting it? Things like that. So check that out if you've got some time. And then on the bottom of your screen are some of our reports. And so, you know, we've got something about home visiting. We've got our most recent ACEs information. And again, how we can transform the system. You know, because that's just something we've been chatting about for a long time with you folks. So check those out if you haven't already. And here's where I tell you guys how thankful we are, because we mean it. We really are so thankful for our sponsors, Texas Child Welfare Funders. They sponsored this event last year and sponsored this again. So thank you very, very much. This shows how much you value these conversations as well. Thank you to our partners over at OCOK. Courtney, you know, I love to partner with you on anything and everything we can. You guys are doing such awesome work. I love being in the same space as you. Y'all are such great partners. And of course, to everyone that joined us today. you could have done anything with your hour and a half, and you chose to spend time with us. So thank you so much for doing that. Really, your information that you provide us, any insight, all those conversations we have is just so invaluable. We love it. Thank you again. And especially for those of you that joined last time and joined today, like, you guys are rock stars. Thank you so much. And then last but not least is our contact information. So you guys didn't get to meet Jordan today, but Jordan is also part of the policy team. She helps us hold things together, but you got to meet myself, obviously, and Brittany and Emily. But here is our information if you need to reach us. Like I said, we hope this isn't the last conversation we have with y'all, but here is our phone numbers and email addresses. If anything stood out to you guys today that you want to either provide information on or ask more questions about, please don't hesitate to reach out to us. So, oh, that's it. Okay, so I thought I had one more slide, maybe not. But thank you again for joining us. And we're going to give you back a couple minutes of your day. Enjoy the rest of your week, and I hope everyone has a happy holidays.